Hi, my name is Jillian Shotwell. I'm the Quality Improvement and Outcomes Program Manager here at Healthwise. Today, this video is meant to give you a high-level overview of our Quality Improvement and Outcomes program and how we can really support your organization in achieving outcomes and quality improvement measures that are important to you in terms of improving provider efficiency, patient education, patient outcomes, ROI, etc. So, as a team, we're really here to support you in three different main areas. So, innovation, pilots, and demonstration projects happening at your organization. So, think things like Center for Medicare and Medicaid Innovation Demonstration grants you might be a part of. We're here to help support with research grants, so funded research studies that might be happening where patient education could be a beneficial part of the intervention, as well as quality improvement work happening. So, say, increasing education use or utilization to try to meet a specific goal in a certain department or a certain area, or even system-wide goals. So, think HCAP scores or quality metrics that you're trying to meet organization-wide. Our team really aims to demonstrate the value of patient education in a variety of different health settings. We're here to help analyze and interpret data in-house, and we work with our partners and our clients to build effective and high-impact project plans and then take action on them. So we can help to measure the impact of education areas that are really most important to you. So, for example, let's say you provide Healthwise education content for patients after hip and knee replacement surgeries at your hospitals. We can help to show how Healthwise content has been a piece of those efforts your hospital has taken to decrease, say, readmission rates for this high impact topic. So, has an increase in education use alongside, say, patient safety metrics or a transitional care program impacted those readmission rates? Ultimately, our goal is to connect innovative clients with one another. We have hospital system and insurance clients across the US as well as in Canada. And we really like to learn from, share, and connect together those folks that are really focusing on best practice standards across the US and beyond. Our team focuses on two key areas of support. So one is quality improvement and the other is data visualization. All of our quality improvement projects are collaborative endeavors. We use internal Healthwise data around patient education and information you have on your end to focus and really dive into that question or project of interest. The mutual goal is to really identify the effect of patient education on impacting quality as well as metrics important to your organization. So we really can't do a quality improvement study without that data and without those analytics. So we're here to both support with robust data to help identify data points you might need on your end, to clarify those asks and to support you in really developing this robust project in quality improvement. So to provide you with just a few project examples that we've worked with folks on in the past, I brought a few different examples here. This is by no means limiting to what we could do. We could really focus on any quality improvement project or any high impact condition that is most important to your organization. In terms of decision support, we work with a lot of researchers and a lot of organizations on decision support for challenging patient decisions. One specific recent research project that we supported was on decision support for trial of labor after cesarean section for pregnant women. This study utilized one of our decision aids for women who were pregnant, who had a previous cesarean and were deciding about whether they'd like to try labor for their next singleton pregnancy. This study measured decision conflict. So how conflicted did these women feel in making this decision? So that was both for those who didn't receive our Healthwise decision support tool and those who did, as well as birth outcomes. So what actually happened? Did a woman who wanted to try labor after cesarean, were they actually able to follow through with it? And did that differ between the group that used Healthwise decision aids versus the group that did not? For both of these outcomes, the researchers saw a decrease in that decision conflict for women who received that decision support tool. So they felt more certain about their decision of cesarean section versus not. And then in terms of birth outcomes, actually more women who received the decision aid tool actually went through with their preferred mode of pregnancy than those who did not receive the decision aid tool. So some pretty impressive outcomes from this research study. And we support many other researchers with different decision support tools, and would be happy to chat about those further. We also supported a quality improvement, so not a research project, at Duke University around smoking cessation. So here we partnered again with both Duke University Medical Center as well as one of their digital health partners to send smoking cessation content to a patient's after visit summary if they were identified as a smoker. What this was meant to do was to provide really just information around the benefits of smoking cessation, so some Healthwise education there, as well as to reach as many folks as possible at the organization around this smoking cessation program that Duke had. And they stratified outreach to these folks based on contact preference. So whether it was email, whether it was just sending stuff right to the after visit summary, or whether it was text message, our integration with Duke's digital health partner here really helped allow for that individualized send of education. And you'll see here outcomes for this program were really impressive. This smoking cessation program at Duke saw a 30 to 35 times higher cessation rate compared to someone unassisted trying to quit smoking. And they saw a really high level of member engagement from this individualized outreach. They sent over, I believe it was a million sends of this information to different patient charts. And they had a really high engagement rate because, again, of that individualized way of outreaching. And then in terms of HCAP scores, we did work with a large health system to take a look at HCAP scores before versus after the implementation of Healthwise education at bedside for inpatient folks. We did see here that increased education at bedside correlated to an increase in education-related HCAP scores. And what we looked at there were the doctor and the nurse explain HCAP scores. So there's so much more to say about all three of these project examples. We have more in-depth client stories for all three of these, and we have, as I mentioned, many other client stories. So if you have additional questions on either of these, or if you would like to chat further about an idea you have for your organization, or even something you're already working on, please feel free to reach out to your account manager and we can set up some additional time to chat through these. So in summary, we're here to help support your quality improvement projects, your ongoing strategic initiatives, as well as your funded research studies happening at your organization. We can be as involved or as uninvolved as is best for you. So if you just need that analytics help or that project management help, please reach out. We're happy to be flexible. And we can also help to collaborate there on that data analytics and data visualization piece as is helpful. So please feel free to reach out to your account manager if you'd like to chat further, and we would be more than happy and excited to support any quality improvement initiatives happening at your organization. Thanks very much.